Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to discuss a series of exercises known as the Williams Flexion exercises. These exercises are for low back pain, specifically for pain or symptoms that increase when you bend backwards. So we want to stretch going forward. With this series of exercises and with any exercises, one of the general rules is that if any exercise or stretch elicits symptoms or intensifies symptoms, you want to stop that motion, that exercise, that strengthening exercise, that stretching exercise immediately. You can modify it so that you are still getting the benefit, but you are not feeling an increase in symptoms, or you can just skip that exercise and find a viable substitute. The Williams Flexion exercise series consists of 4 stretching exercises and 3 strengthening exercises. When you are performing these exercises, you want to make sure that you begin at your current fitness level. Do not try to use the same level of intensity that you used before you were injured or when you were younger. Please start at your current health and fitness level. Also, do not self-diagnose yourself. Please see a medical professional, get the proper diagnosis, and determine the correct path to your recovery. If these exercises are in that path, then please use them to your advantage. When performing the stretching exercises, always move into the stretch slowly. Move into the stretch slowly. I'm going to say it one more time. Move into the stretch slowly and hold a mild, comfortable stretch. You are stretching to reduce muscle tension. You are not training to be a contortionist. You are not training to be a circus performer. Please hold a mild, comfortable stretch. You can perform these stretches anywhere from 5 seconds to 120 seconds. I think the ideal time is between 30 and 60 seconds, but you have to find the amount of time that works best for you. When performing the strengthening exercises, again, start at your current fitness level. Always work through a pain-free range of motion. Move slowly and control the motion. Control the positive and the negative aspect of the exercise. That means the concentric and the eccentric movement should be slow and controlled. The 7 exercises in the Williams Flexion exercises include 4 stretching exercises and 3 strengthening exercises. The 4 stretching exercises are the supine knee to chest single leg and the supine knees to chest double leg. Also, hip flexor stretching and hamstrings stretching. The strengthening exercises include the pelvic tilt, crunches, and bodyweight squats. I'm going to start the stretching with the supine knee to chest stretch. This is a stretch for the muscles in the gluteal region and in the lumbar spine. You're laying on your back. You want to make sure that the back of your head and your shoulder blades are contacting either the floor or the table, whatever surface that you are using. I'm going to start with the single leg. You're going to lift the leg that's going to be stretched by flexing the hip and flexing the knee, and you take both hands and you reach behind the thigh close to the knee. You don't want to grab the front of the shin because this could put too much pressure on the knee. So you reach behind the thigh and you slowly bring the thigh towards the knee on the same side. Move it slowly. Once you feel a mild, comfortable stretch, hold that position. You want to breathe normally and just relax. You will feel a stretch in the gluteal muscles. And then when you're done, move out of the stretch slowly. Wherever you start to feel that stretch, you hold that position. And then you perform it on the opposite side. Even if your pain and symptoms are on one side, you still want to stretch both sides. So that is the single leg knee to chest stretch. Now the next one is the double leg knee to chest stretch. You're going to flex both hips and flex both knees. You're going to reach behind your knees, behind your thighs. You don't want to go behind the knees. You don't want to be in front. You want to reach behind and just interlace your fingers, lock your fingers, grab your wrist on the opposite side, whatever is most comfortable for you, and hold that position throughout the entire stretch. Keep the back of your head and your shoulder blades on the table if you can, and then slowly bring the knees towards the chest. You will feel a stretch in the gluteal muscles and in the spine, and you want to try to stretch so that you are bringing the back of the pelvis off of the table. This will increase the stretch in the lumbar spine muscles. The next stretch that you want to perform is for the hip flexor muscles. The hip flexor muscles are the powerful muscles in the front of the hip. These muscles are very important for stretching for low back pain because they do originate on the side of the vertebrae in the lumbar spine. Then they attach to the front of the pelvis, and then another muscle forms, and the two muscles come together and they attach on the inside part of the femur. The femur is the medical name for the thigh bone. These muscles, when they are tight, can cause pain and symptoms in the lumbar spine, in the pelvis, and in the thighs. So stretching these muscles is very important. Now I'm not going to demonstrate any hip flexor stretches on this video because I have a separate video on that. You can watch that and learn a great deal on stretching the hip flexor muscles. The next stretch is the hamstring stretch. The hamstrings are these powerful muscles in the back of the leg. They perform hip extension, which is moving the thigh backwards, and knee flexion, which is bending the knee. They also assist in rotation of the hips and of the lower legs. So these are big, strong, important muscles. One of the best ways to stretch the hamstrings and help the low back is by doing it in a seated position on a table just like this. You can also use a chair, but make sure that chair is sturdy and does not have wheels. You want to be as safe as possible. When you are stretching on a table or a chair, you want to sit as close to the edge as you possibly can in a safe position. When stretching the hamstrings in a seated position, you can use a variety of angles with the legs, where you have the legs spread out. You can have them close together or at any distance in between. What you're going to be doing is you are just moving forward, hinging at the hips. You're not bending the spine, you're keeping the spine straight. And an easy way to do this is to just put your hands right here on the front of your hips, and this will assist so that you know you are moving the hips and keeping the spine straight. Move into the stretch slowly and hold a mild, comfortable stretch. We're going to proceed to the strengthening exercises. The first one is called the pelvic tilt. This is a fundamental core strengthening exercise. This should be the first core strengthening exercise that you perform after an injury. And this is a very basic movement. There is not much motion involved, and you are shifting the pelvis so that you're flattening the lumbar spine against the surface that you are laying on. You are supine, your hips are flexed, your knees are flexed, and your feet are flat on the floor. I like to have people so that they either place their hands behind their back or they place their hands on their hips so that they can actually feel the motion that they are doing. You're not sucking in the gut, you are shifting the pelvis. Your pelvis shifts in this direction, and you hold an isometric contraction for 2 to 6 seconds. Start at 2 seconds and build to 6 seconds. When you are performing the strengthening exercises, they should not be performed every day. The stretching exercises can be performed every day, but the strengthening exercises, you want to have at least 1 day's rest in between. If you're still sore, then you could do 2 or 3 days rest in between. Again, on the pelvic tilt, this is a very basic fundamental motion. You are shifting the pelvis so that you are holding the lower spine against the surface that you are laying on, and you are contracting the abdominal muscles. These muscles contract to tilt the pelvis, and you hold this contraction for 2 to 6 seconds. Now, once you have mastered the pelvic tilt and you could perform 15 repetitions for a 6-second hold, then you want to advance to the crunch. The crunch is also a fundamental core strengthening exercise. You are laying supine, the hips are flexed, and you're going to flex the hips to about 90 degrees and let the knees relax. Some folks like to hold the knees like this, really whatever works for you, but I like to tell people to relax the knees so that your thighs are pointing towards the ceiling. Now on this one, you want to do the pelvic tilt, and you're going to hold that position throughout the entire exercise. Remember, we did the pelvic tilt just a few seconds ago, and you want to hold that position. From here, the crunch is done 2 different ways. You can raise your upper body towards the ceiling, or you can curl your upper body towards your thighs. When you raise towards the ceiling, you are doing this type of motion. And you will feel this in your abdominal muscles. Again, attempt to hold the pelvic tilt. If you lose the pelvic tilt after a repetition, then just get that position right back and perform the crunch. And then the second way to perform the crunch is to curl the upper body towards the thigh. So you're doing this. In both ways, you're going to work the abdominal muscles. The final strengthening exercise of the Williams flexion exercise is the bodyweight squat. This is an advanced exercise. When you are doing squats, first of all, you want to make sure that the entire chain is healthy. The ankle, the foot, the knee, the hip, and the spine all have to be healthy. If you have an issue, say for example with the ankle on one side, that's going to throw everything off. Okay, if you have an issue with the hip on one side, it's going to throw off your technique. So please, you have to make sure that the entire chain is healthy. What you want to do when you do bodyweight squats is put your feet so that they are slightly wider than shoulder width. Keep your spine straight. Keep your eyes looking straight ahead. You don't want to be looking up. You don't want to be looking down. You can put your hands on your hips to start, or you could put your hands out front, whatever feels more comfortable for you. And then you squat down as if you are sitting on a chair behind you. So you move the pelvis backwards as you are sitting down. You want to make sure that your knees and your feet always point in the same direction, and you want to move through a pain-free range of motion. Even if that motion is very, very slight, say your motion is just several inches, that's okay. Thank you everyone for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I covered the Williams flexion exercises for the lumbar spine. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You could visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also visit my blog. My weekly blog has articles on spine health, on health overall, on fitness and sports medicine. Please feel free to like this video. Please, if you have suggestions, questions, or feedback, leave them in the comment section below. If you want to, please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, you are on my YouTube page. Thanks again for watching today's video, and always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.